Hi. So today I'm going to show you how to do the exam of the head and neck and the hair, skin, and nails. So the first thing I'm going to do is put my gloves on. So I always put on gloves. And I'm going to go through and tell you kind of what I want you guys to verbalize as we're going through. You know, verbalization is a part of the physical exam we have you do, so we know that you know what you're doing. So the first thing I'm going to do is inspect Lori's scalp. And this is going to involve, looking, but then, also parting her hair around and looking at the scalp itself. So, and then you're going to tell me I'm inspecting the scalp. The next thing we're going to do is inspect and palpate the skull. So again, you're going to tell me I'm inspecting the skull. And for this, you just want to feel all around on the skull bones, and make sure you don't feel any lumps or deformities or anything like that. Just tell me that you're inspecting it. The next thing we're going to do is inspect and palpate the facial skin. So we're going to come in front of the patient, look at her facial skin, and then we're going to palpate it as well. And you're going to tell me that you're looking at the patient and observing their faces. And we will talk about what that is in class. All right. The next thing we're going to do is inspect the anterior neck. And for that, we're going to come right in front of the patient and just look straight on. And when you're here, I want you to verbalize that you're inspecting for symmetry, masses, scars, enlargement of the parotid glands, enlargement of the submandibular glands, and then visible lymph nodes as well. So you're going to list those 6 things for me. And then finally, the last thing we're going to do is inspect and palpate the trachea. So you're going to verbalize that you're inspecting the trachea, and then you're also going to palpate it as well. So you're just going to come in here and feel in the middle. Usually what I do is take 2 fingers and then just kind of move it back and forth and make sure it's freely movable. So that's the first part. Now we're going to move on to the thyroid. So with the thyroid, we're going to stand in front of the patient again, and we're going to ask the patient to extend their neck back a little bit. And we're going to verbalize that we're looking at the thyroid for both contour and symmetry. Next, we're going to observe the movement of the thyroid anteriorly. So for that, I'm going to have the patient swallow some water. If you don't have water, that's okay. It just makes it a little easier on the patient instead of just trying to swallow dryly. But we're just going to ask her to swallow some water, and we're going to watch the thyroid move. So what we're doing is just watching here, and we're watching that move up and down. Perfect. Thank you. Next, we're going to palpate the isthmus of the thyroid, and we're going to do that from behind. So what you're going to want to do is come behind your patient, and I'm going to position you this way. Thank you. And you're going to want to take your 2 fingers here, find that isthmus, and then palpate it. And then you're going to want to palpate these different lobes of the thyroid too. We're going to ask her to have her neck just extended just a little bit. It makes it a little bit easier to feel. And the last thing we want to do is palpate the lobes while she's swallowing. So again, we're going to feel that movement of the thyroid. So we're going to go ahead and place our hands in position first to feel these lobes, and then go ahead and ask her to swallow. Good. We're just feeling for the movement of the lobes as she swallows, and you can feel it as your patient's doing that. That's great. Thank you. All right, we're going to move on to the lymph nodes. I'm going to have her flip back around for me. So the way we want to palpate lymph nodes, again, is going to be with these 2 fingers. And when you palpate them, you're going to want to go in and go in a circular motion and rub them and palpate them just a little bit deeply. So what you don't want to do is go in and almost like you're tickling the patient. And sometimes you'll see practitioners do that, but that's not what we want you to do. We want you to take those 2 fingers, come in and rub with a circular motion on each of the different spots that we're looking for the lymph nodes. So you're going to go in and palpate those, and as you're going through, you're going to tell me the name of the lymph node that you're palpating. So we're going to start off with her preauricular. That's going to be in front of the ear. Then we're going to go to posterior auricular. That's going to be behind the ear. Then we're going to go to her occipital lymph nodes. It's going to be back here in the back of her head underneath the occiput, and rub there. Next we're going to go for the tonsillar lymph nodes. That's going to be right here at the angle of the jaw. Again, that circular deep rubbing motion. Then we're going to move onto the submandibular lymph nodes. That's going to be right here about mid-jaw. And then here to the submental under the chin. Next we're going to do the posterior cervical. So those are going to be on the posterior side of the sternocleidomastoid muscle. So back here. And these are typically in a chain. So you're going to want to start here at the top and go down towards the bottom. Next we're going to palpate the superficial cervical. So these are going to be right on top of the sternocleidomastoid muscle, the SCM. And then we're going to want to palpate the deep cervical node. So for that, you're going to push just a little bit deeper in that same spot on top and in front of the SCM. That circular motion. Finally, we're going to do the supraclavicular. So on Lori, she's got this beautiful, beautiful dress on. But what you're going to do is look for this, her clavicle bone here. And you're going to start here in the middle and work your way out on top of that clavicle, feeling for those lymph nodes there. Okay. The last thing we're going to do with lymph nodes is I want you to mention to me and verbalize the characteristics of a lymph node. So those are going to be size, shape, delimitation, mobility, consistency, and tenderness. That concludes the lymph node portion. Next we're going to do the hair, skin, and nails portion. So we'll start with the hair. So we're going to come back up here to the head and we're going to inspect and palpate the hair. And for this, you're going to tell me that you're inspecting for the quality, the texture, and the distribution of the hair. Next, we're going to inspect and palpate the nails of the upper extremities. So I'm going to ask her to give me her nails, and we're going to go through and palpate each nail, just like that. Just feeling for any abnormalities, bumps, lesions. We want to hit each nail. Good. And then we're also going to do the nails of the lower extremities. So we're going to come down here and look at her pretty pink toesies.
Do not come close.
Yours look better than mine.
Oh my God.
So we're going to palpate these nails down here. Same as we did on top. And we're going to do both feet and all of the toes.
I do not have a pedicure.
Good. You're good. And then we're going to list off the characteristics of the nails. So that's going to be color, shape, texture, and lesions. So when you're palpating, those are the things that you're feeling for. Next, we're going to do a general inspection of just the skin overall. So for that, you're really, and typically you'd have the patient in a gown. We didn't make Lori change today, but you're just going to look at the skin of the upper extremities and the lower extremities. The skin of the neck. You've already done part of this in your neck exam, and you can do of the back and abdomen as well. And really, when you get to the different regions of the body when we're doing this physical exam, you're inspecting these things again. So this is just an overall general inspection of the skin. Excuse me. Then we're going to verbalize a few things there. Color, moisture, texture, temperature, and turgor. So those are the things we're looking for when we're looking at the skin. We're going to inspect the skin of the face and just tell me that you're inspecting this. Then we're going to inspect and palpate the skin of the upper extremities and just tell me that you're inspecting that. And we're going to do both sides. And we're going to also palpate the palms bilaterally and look there. That's great. And then we're also going to look at the inner digits and inspect there. So a lot of times you can find there are skin infections that you can get in between your fingers. So that's a good place to look there, but you're going to look at those inner digits. Good. And then we're going to do the skin of the lower extremities. So we're going to go just look at the legs as a whole, And then we're going to come down here and inspect the feet, and we would look at the inner digits of the feet and the toes. So we would go again back through and look between each one. And then we would also inspect the soles of the feet. I'm not going to have her take off her shoes, but the soles of both feet, here and here. Almost done. We're going to inspect the anterior trunk, and again, remember she's in a gown, so you can lift up the gown and expose what's necessary. And then we're going to come back here and inspect the posterior trunk. Perfect. And inspect the posterior trunk. And with that gown, again, you can expose what's necessary only. And then you're going to mention to me or to your proctor that you would inspect the groin. I do not expect you to inspect the groin on your patient until you get out into the real world and are doing the physical exam. And then the last thing you're going to do is verbalize to me the characteristics of a lesion. So for when you're looking at lesions, you're looking at the anatomical location, you're looking at the distribution, the arrangement, the type, and the color. And typically what we'd like you to do too is find a lesion on the patient's skin. I'm going to turn her around again one more time. And this can be something very simple. So we'll just find like Lori has a little freckle. So we would describe that lesion as being on, the left upper extremity. It is a brown macule. That's the color and the type. The distribution is single. There's only one, and the arrangement is that as well. There's only one, so it's just there. But you could have different characteristics of different skin lesions. So that's it for head and neck and hair, skin, and nails. Thank you.